Hey everybody, thanks so much for watching this video. So I just wanted to take a moment to just go over some concepts about fetal circulation and ductus arteriosus, because I think it's important to understand before the sim session. So this is, we're going to chat about fetal circulation a little bit here first. So in normal fetal circulation, what happens is that oxygenated blood comes from the placenta, which we'll say is down here. And so this is oxygenated blood, and it's going into the IVC. IVC is here, and then it's dumping into the right atrium. And so now you have oxygenated blood in the right side of the heart. So how is that oxygenated blood going to get into the systemic circulation? So there's a couple of ways that it does that. So one is through a foraminal valley that sits between the right atrium and the left atrium. And because the right side of the heart in fetal circulation has more pressure, the oxygenated blood goes from the right atrium through the foraminal valley into the left atrium, and then you have oxygenated blood go to the left ventricle and then out through the systemic circulation. So the other way that oxygenated blood gets into the systemic circulation is through the ductus arteriosus, which connects the aorta and the pulmonary artery right here. So what happens is that the oxygenated blood not only goes into the foraminal valley here, but also goes into the right ventricle, of course, and then out into the pulmonary artery. And then because of that ductus arteriosus, I'll just label this, the oxygenated blood goes from the pulmonary artery into the aorta and then across into the rest of the body. So this is just an important concept to understand when we talk about, why we want to sometimes keep the ductus arteriosus open. So this is coarctation of the aorta. And in this neonatal issue, cardiac issue, which is, of course, one of many neonatal cardiac issues, the main problem is that there's narrowing of the aorta here. And so the amount of blood that gets to the lower parts of the body is actually quite limited. The amount of, oxygenated blood that gets to the lower part of the body is quite limited. However, because that ductus arteriosus remains patent or open, some blood is able to get into that lower parts of the body, especially in this specific diagram where the patent ductus arteriosus sits at the level of the coarctation. So it's often either at the level or distal to the coarctation. So some blood is able to reach that lower part of the body. Despite the fact that it's deoxygenated, it's at least something. Once that ductus arteriosus starts to close, after a day or two post-birth, of course, you can imagine that now very little blood, if not no blood, is actually getting into the lower part of the body. However, oxygenated blood is getting to the upper part of the body, no problem. So in order to save that little baby, that little kiddo, one of the things that we do is we give something called prostaglandin to keep that patent ductus arteriosus open until surgery can be performed. And so, clinically, what you might see as the ductus arteriosus starts to close are a couple of important clinical signs. So because there's oxygenated blood getting into the upper part of the body, you might see oxygen, normal O2 sat. You're going to see normal blood pressure in the upper limbs, and in the lower limbs, you're going to see low O2 sat and low blood pressure. And so, in terms of the O2 sat, for example, there being a difference in the upper limb versus the lower limb, that's that, classic teaching of pre and preductal, which is upper limbs. So preductal, so before the ductus. Again, the ductus is here, so all of this is before the ductus, and then post ductal oxygen saturation and blood pressure. The other thing that you're going to find is that the pulses in the lower limb, specifically, in a baby, it's easiest to feel the femoral pulse. So the femoral pulses will be blunted or essentially non-existent. So these are some things to look for specifically in coarctation. As an example, of course, the clinical presentation of other cardiac lesions in neonates are going to be all very different, but the key is the ductus arteriosus, because it connects the pulmonary circulation to the systemic circulation. It allows some blood flow between those two areas. So whether it be improvement in oxygenated blood to the systemic circulation, or just generally more volume of blood into the pulmonary circulation in some cases, where very little blood is actually getting to the pulmonary circulation. It's important either way. So keep in mind that a lot of the cardiac lesions that we see in these babies are what we call ductal dependent lesions. So so that's a basic summary of fetal cardiology and ductal dependent lesions and what the ductus actually does. So keep those things in mind during the sim, and hope to see you soon.